Howdy, I'm Amethyst with Sullivan Physical Therapy, and I wanted to chat a little bit about questions I get with people with prostates who say, is this prostate pain? I'm going to use general terms today of male pelvic pain, but I would like to encourage and ensure that we treat people of all backgrounds and genders and sexes. So please just feel free to be confident in talking about your therapist about what words are good and comfortable to you. But what I wanted to discuss is that oftentimes I have someone come in and say, feels like I have prostate pain, but I go and it gotten checked by the doctor and I don't have an infection, or something along the lines of I had an infection and I took antibiotics, and when I went back, the infection's gone, but all of my pain or symptoms are still there. And usually that's when I say I'm the right person for you, because what can happen in that part of our body is that the muscles will start to create pain that feels really similar to what the organs in that area do, like the prostate or bladder or bowel, for example. I wanted to go over the model so that people can get a better idea of why that might happen, because more often than not, when I do a rectal exam, for example, we can reproduce some of those prostate pains. And a lot of my guys are really surprised by that because they share such close relationship to each other. So if we go ahead and grab this model here, make sure everything stays in place to start. I'm gonna go ahead and orient ourselves to positioning. Oh no, I'll grab that in a second. So from front to back, penis, testicle, anus, tailbone. And if we take a look at everything that just fell out, actually, we'll go ahead and put that back in. What we're gonna have here's the prostate, bladder, rectum. The urethra is going to run from the bladder through the prostate and through the penis, where you'll eliminate, and then anus here, or anus and rectum. But what's very important to look at is actually all of this pink here and this pink spot here. And if we were to go ahead and remove those organs like it showed us earlier, we see this band of pink through here. All of those are muscles, or what we call the pelvic floor muscles. And oftentimes, since the prostate sits directly nestled inside that bowl, they can often produce pain really similar to the prostate, or kind of hold on to pain whenever you were experiencing an infection that has now dissipated and been cleared, but something still doesn't feel quite right. When someone comes in with those symptoms, I do think it's an appropriate time to do a rectal exam. But your therapist will decide that with you, and only based on what you're comfortable or okay with. But that way we can get a better idea with a gloved, lubricated finger inserted and apply pressure onto those muscles and right alongside either the prostate to see if any of those things reproduce your pain. If so, or even if it doesn't necessarily reproduce it exactly, but you notice stinging or very sharp tenderness, that can still be signs that those muscles, at the very least, are perpetuating, if not the exact cause of what's happening. Similarly, what I often find people say as well, if it's my prostate, are you going to do a prostate exam? And I will usually say, no, I am not trained, nor at least personally feel confident to say your prostate is enlarged or small. There are some instances where I do feel that way, but your physician would be the best person to indicate that for you. My job is to look at the muscles and bones and nerves specifically. So I won't technically do a prostate exam. I sometimes will feel right alongside or on the prostate, because sometimes, again, that can give us a better idea of if I check all of the muscles, pain isn't coming from there, and then I check directly on the prostate, and that's the only place it's been reproduced on our exam, then that might be a better idea that it's not necessarily coming from the muscles, and it might be appropriate to refer back to your physician. The other thing is, typically people ask if it's prostate pain, should I do Kegels to help because maybe I'm experiencing instances of leakage or premature ejaculation? And the answer is typically no. I don't think it's necessarily the first line of defense, but again, that might be very dependent and specific to you. So that would be something you want to caution if that's something you're doing, or stop or pause because some people notice that might make their pain worse. The other thing in regards to is it my prostate that's hurting is not only the muscles, but in fact the bowels, since the um, rectum sits directly up close towards the prostate. Oftentimes, if the prostate is inflamed or a little bit more sensitive, when there's more stool sitting inside the rectum, it can create more pressure onto the prostate, and that can oftentimes make symptoms worse. So managing constipation is really important and helpful. So drinking plenty of water, eating fibrous fruits, vegetables, whole grains, making sure you're getting daily exercise so that bowels can continue to move, because that can be another reason that maybe that's not necessarily where pain is directly coming from, but certainly exacerbating pain. So that would be another reason to stay on top of that. So I would like to at least say have an openness to understanding pelvic floor anatomy, because sometimes it can feel so direct onto the prostate, but our body has a very hard time differentiating different pieces when it comes to our pelvis. So sometimes the pain might not be coming from the prostate specifically, but from the surrounding muscles, and not only from pelvic floor like we saw in the model, but nearby areas, for example, working front to back at glutes, the perineum, where it is still pelvic floor, but a little bit more superficial rather than deep. Inner thigh muscles, because they come in and attach right near the pubic bone. Belly muscles up through here, they'll come in and attach near pubic bone. And that will give us a better idea of what other surrounding muscles besides pelvic floor might be contributing to prostate pain as well, or at the very least making it worse. I hope that gives you a better idea of what to expect if you are experiencing prostate pain and what you might anticipate at your first visit. We look forward to chatting with you.